The unemployment rate in Florida is close to 10%. People will do just about anything to keep their job, even brave needles and surgical procedures.
But morning anchor Lauren Rowe looks into whether you really have to go to extremes to be competitive in this horrible economy.
I get the injections done probably about 3 to 4 months, all over the forehead. You know, getting rid of the nice crow's feet around the outside of the eyes and my little canyons that seem to appear ever so diligently, every few weeks.
Looking at Susie, a 40-something-year-old sales rep, it's hard to believe she'd be worried about losing her job. She's beautiful and bright, and there are no signs of those canyons she claims are forming above her nose. But for years, she's endured painful shots and procedures.
When you're out in public, you really want to look good. And with none of us getting any younger, you want to maintain what you got.
Do you sell more, you think, because you look better?
Wow. I think I can get in front of a lot more customers by looking good and looking the part. Absolutely. Do I sell more? Well, maybe.
Susie's first surgery was breast augmentation, but she now relies on chemical peels and Botox, not nearly as invasive or expensive. But this woman, who didn't want to be identified, got more than $1,000 worth of Botox in one visit.
Some women are coming in and asking for plastic surgery, not for the usual reasons of trying to look younger or working on wrinkles or loose skin or fixing a particular body part, but they're saying, make me look better so that I can be competitive and land a better job, because they think that if they look better, they'll have a better chance of success when it comes time for the job interview.
But is it really necessary?
Okay, relax.
The number of age discrimination complaints in Central Florida have actually dropped so far this year. And according to the government, sales reps are not getting younger.
What if I were to tell you that over the past couple of years, in the sales business, the median age hasn't changed?
You have to look as best as possible. Otherwise, people are not going to buy from you. You're not going to sell a darn thing. It does make a difference to look good.
It's safe to say that more and more women will choose to sit in a plastic surgeon's chair. The Society of Plastic Surgeons found that 1 in 10 women are already considering a procedure to be more competitive in the job market. And 73% of those women say they believe appearance, especially in these tough economic times, will help them get a job, get promotions, and get new clients.
On a scale of 1 to 10, 10 being priority, it's truly 11.
You've had friends who've done pretty drastic procedures because they felt like they were going to lose their jobs. I mean, how do you feel about that?
I actually think that's pretty sad. It is pretty sad, but you know what? You really have to maintain your job, or you're going out to get one, and you really have to maintain your looks.
And raise your eyebrows again for me.
And Dr. Fiala says these less invasive procedures are not just for rich people and executives anymore. His newer clients are women and men of all ages from all social groups.
And there are numbers to back up Susie. A study by the New York Academy of Sciences found that attractive people have a significantly better chance of getting a job, especially if the interviewer is the opposite sex.